No antibiotics, no anesthesia, no idea that germs even existed. And somewhere in a cave on the island of Borneo, 31,000 years ago, someone cut off a child's leg, and the child lived. Not for a few days. Not long enough to die quietly out of sight, forgotten by everyone but the person who wielded the blade. The child lived for 6 to 9 more years afterward, walking on a healed stump, before finally dying as a young adult in their late teens or early 20s. No modern hospital, no sterile instruments. No way to fight the infection that, by every reasonable expectation, should have killed within the week. So how does a surgery like that even survive the surgery itself? In 2020, archaeologist Tim Maloney and his team excavated a burial deep inside Neanderthal Cave on the Indonesian side of Borneo. What they found was a skeleton missing its lower left leg, and the bone at the amputation site told the whole story on its own. It was smooth, rounded, remodeled, the unmistakable signature of a wound that healed rather than one that killed. Radiocarbon dating on burned wood found nearby, cross-checked with a separate dating method run on a tooth from the jaw, placed the surgery at roughly 31,000 years old. That is almost 24,000 years older than the next oldest confirmed amputation anywhere on Earth. Whoever performed that operation knew exactly where to cut. Too high on the limb, and the bleeding alone would have killed the patient within minutes. Too low, and infection from the exposed wound site would have spread through the whole leg regardless. They found the narrow, precise window in between, using nothing but a sharpened stone blade and knowledge that nobody, anywhere, had written down. This should not have been possible in a world with no penicillin and no understanding of bacteria at all. Think about what that surgeon actually had to know before making the first cut, where the major blood vessels ran beneath the skin, how much pressure a wound needed to stop bleeding without cutting off circulation to what remained. What the surrounding community likely relied on for that knowledge was decades spent butchering deer, wild boar, and other game, tracing the same muscles, joints, and vessels in animal bodies again and again until the anatomy became second nature. A hunter-gatherer's everyday survival skill quietly doubled as medical training, long before anyone thought to call it that. And yet, Borneo was not an isolated miracle. Rewind another 14,000 years to a cave in the Zagros Mountains of Iraq, and you find a Neanderthal known to researchers only as Shanidar I. In 1982, paleoanthropologists Eric Trinkhaus and Michael Zimmerman examined his skeleton bone by bone, and what they found reads like a list of injuries that should have ended a hunter-gatherer's life on the spot. A violent blow to the face, likely leaving him blind or nearly blind in one eye, a crushed and withered right arm, the lower portion gone entirely, amputated or lost decades before death, a limping, deformed leg, partial deafness. He lived into his 40s anyway. In a world with no permanent shelter, no stored grain, and no food beyond what the group physically carried and hunted that season, someone kept a one-eyed, one-armed, limping man, fed, warm, and alive for decades. He could not have tracked game. He could not have defended the camp. Every single calorie that kept him breathing came from someone else's effort, freely given, season after season, for no return except his continued presence among them. Trinkhaus and Zimmerman put it plainly in their findings. Neanderthals had reached a level of social organization where the group simply did not abandon its wounded. That raises an uncomfortable question, though, because keeping someone alive takes more than kindness alone. It takes knowledge. It takes knowing what a damaged body actually needs in order to heal. So where would early humans have even learned that? Part of the answer, it turns out, was sitting in their own teeth the entire time. In 2012, archaeologist Karen Hardy examined the fossilized dental plaque of 5 Neanderthals from El Sidrón in northern Spain, using a technique sensitive enough to detect microscopic particles trapped there for tens of thousands of years. Buried inside that plaque, she found chemical traces of yarrow and chamomile. Both plants taste bitter, sharply so. Neither one offers any meaningful nutrition. What they do offer is medicine, well known even today for easing digestion and calming inflammation. And Neanderthals appear to have been chewing them anyway, deliberately, for reasons that had nothing to do with hunger. Chewing a bitter, nutritionally useless plant on purpose is not an accident. It is the earliest known fingerprint of self-medication, tens of thousands of years before anyone could explain why chamomile calms the stomach or why yarrow slows bleeding. Ötzi, the 5,300-year-old mummy found frozen in the Alps, carried that same instinct even further, quite literally, on his person. Threaded onto a leather string alongside his gear, researchers found pieces of a birch fungus. In 1998, paleopathologist Luigi Capasso examined that fungus and connected it to something else entirely: whipworm eggs found preserved in Ötzi's intestines. The fungus contains a compound toxic to exactly that parasite. He was not carrying food. He was carrying medicine chosen, dried, and kept ready for exactly the ailment his own body was fighting. Now take that same instinct for careful, deliberate treatment and scale it up to an entire civilization, thousands of years later, on the other side of the planet. In Peru, ancient surgeons were drilling holes directly into living human skulls, a procedure called trepanation, meant to relieve pressure from head injuries or seizures. On paper, it sounds like a near-certain death sentence. In 2018, researchers David Kushner, John Verano, and Anna Tittelbaum studied more than 800 trepan skulls spanning nearly 2,000 years of Peruvian history, and the numbers tell a very different story. In the earliest period they studied, around 400 BC, roughly 40% of patients survived the procedure. By the time of the Inca Empire, more than 1,000 years later, that survival rate had climbed as high as 91%. Compare that to battlefield cranial surgery performed during the American Civil War, with metal instruments and at least a basic grasp of infection, where mortality still ran between 46 and 56%. Stone tool surgeons working centuries before germ theory existed were quietly outperforming 19th century doctors with actual formal medical training. They accomplished that improvement through nothing more exotic than repetition. Generation after generation of Peruvian surgeons refined exactly where to cut, how wide to drill, and how to dress the wound afterward, passing that knowledge down the same way a craftsman passes down a trade, one careful correction at a time, one patient at a time. None of that refinement happened in a single lifetime. A surgeon operating around 400 BC never lived to see the 91% survival rate his descendants eventually reached. He only ever saw his own results, buried his own failures, and adjusted his technique by some small, hard-won degree before teaching the next apprentice what he had learned. Multiply that quiet, unglamorous process across 1,000 years and 800 skulls, and you get something that looks, in hindsight, almost like a controlled clinical trial. Nobody alive at the time would have recognized it as one. So, put the whole picture together. A Neanderthal chewing bitter chamomile for a stomachache no one had a name for yet. A group in Iraq feeding a blind, one-armed man for 40 years because leaving him behind was never considered. A mountain traveler in the Alps carrying antiparasitic fungus like a personal medicine kit. A child in Borneo surviving a stone blade amputation that modern medicine would still respect. Surgeons in Peru refining a skull operation across 1,000 years until it beat the Civil War outright. None of them had a word for bacteria. None of them had a single written page to learn from. What they had instead was something slower and, in its own way, far more remarkable. Careful observation tested on real bodies passed hand to hand and kept only when it actually worked. The next time you swallow a pill without a second thought, or hand your body over to a surgeon you have never met for an operation you do not fully understand, remember that the trust itself is not new. It is the same trust a child in a cave in Borneo placed in whoever was holding the blade 31,000 years before either of you were ever born.